Salud, New Mexico, growing our own and creating equitable opportunities for Hispanic and Latino health.
Just to illustrate what's happening nationally, not only in the state of New Mexico, there's an exponential growth of Latinos, and eventually there's going to be more people of color, 58 million by the year 2016. We're the principal driver of the demographics. We're going to contribute so much to the economy that we are going to make a difference. And I'm speaking for Latinos, but this is, if we look at the issues, it really affects every single people of color.
Half of New Mexico's 2.1 million people self-identify as Hispanic Latino. Some cities and towns in New Mexico have seen the greatest increase in its Hispanic population. Topping the list are Sunland Park, Las Vegas, and Lovington. Long-standing and ongoing social and economic inequities, including health literacy barriers, disproportionate employment as essential workers, and limited access to employment and insurance benefits, leave Latinos at increased risk of contracting COVID-19 and having more severe cases of the disease. In New Mexico, Latinos account for a disproportionate number of COVID-19 cases, are over 4 times as likely to be hospitalized than whites, and their share of COVID-19 related deaths is increasing.
Why are Latinos so disproportionately impacted by COVID? In fact, racial inequalities that are pre-existing that represent broader underlying structural and systemic barriers include racism and discrimination. This impacts not just individuals, but multiple generations of families and their health and well-being.
Latinos in New Mexico lack access to health care. Hispanics are the second most likely to be uninsured in New Mexico, following American Indians. Just 56% of women residing in 3 New Mexico border counties receive prenatal care in the first trimester. It's hard to recruit professionals to a place that has one of the worst school systems in the state, says Dr. Catherine Randall from Luna County's Mimbres Memorial Hospital.
One is the cultural relevance. That principle, when we're talking about vaccines and the importance of the pandemic and what our families are going through, it's very important that we consider language. And the Spanish-speaking language, the language access, lo que hablamos en el sur de Nuevo México no es lo mismo necesariamente que en el norte o que en Chihuahua. So the language access that is appropriate and relevant to that community is very, very important if we want to communicate the importance of the vaccine.
These are some of the laws and regulations, language equity in healthcare and higher education of healthcare workforce in New Mexico and at a national level. Following 10 years of successful implementation, the Office of Minority Health launched an initiative to update the standards to reflect the tremendous growth in the field of cultural and linguistic competency since 2000 and the increasing diversity of the nation. New Mexico Latinos disproportionately suffer from mental and behavioral health conditions. Latinx youth are twice as likely to suffer from sadness or hopelessness and attempted suicide compared to their not Latinx counterparts.
This is KUNM. I'm Marisa DeMarco. Latino youth are feeling the psychological impacts of the Trump administration's immigration crackdown, researchers say. A committee of legislators in New Mexico on Wednesday considered how this problem impacts the state and weighed increasing access to Medicaid. University of New Mexico professor Lisa Cacari-Stone from the College of Population Health spoke before lawmakers. She listed alarming statistics about young Latino people that are especially bad here: spikes in the rates of depression, self-harm, and substance abuse that can be linked to discrimination, violence, and isolation.
Suburban dwellers reported internalization of oppressive factors, while rural communities expressed high stress having to do with not having resources and being given misinformation, not only about services, but about rumors of ICE entering the community, which was actually rapidly spread through community networks. In more recent dialogues with the community, we have noted an increase of stress factors due to COVID-19. At the community level, there is a sense of being invisible and dehumanized, contributing too much to the community stress. Families are trying to find ways to cope with COVID-related deaths. In terms of schooling, families have to make decisions about who works and who should stay at home with young children. Older children are taking on parenting roles as their parents work, or parents not able to understand technology that is required for in-home schooling. School officials also do not have clear understanding of new family circumstances, and older youth are choosing to skip college to help the family, or because there is still fear about being reported to ICE by medical and school personnel. So even filling out a W-9 and providing general information contributes to this stress and fear. We also must recognize and highlight the resiliency that our communities hold in times of adversity. Based in cultural values, we see that familism, communalism, and respect endure. Families support each other in things like cooking, babysitting, lending money to each other, some even turning away help and much respect for other families who might have greater need. They continue to use traditional modes of wellness, from herbs to spirituality. These families do depend on organizations like the New Mexico Dream Team to provide support, including some financial assistance. There's a critical need to address the structures of health and educational systems and its impact on cumulative individual and family trauma. And there is a need to improve resources and accurate information at every single level. A continued CVPR approach will allow us to address relevant issues as delineated by the community members themselves and based in cultural values. This would be in collaboration with trusted schools and community clinics around the state. In part, we may further explore the impact of COVID on this community, along with understanding the diversity within, such as the undocumented queer community, to address their specific experiences and realities.
New Mexico Latinos suffer from preventable chronic conditions across the lifespan. Latino adults have the second highest rates of diabetes in the state, following Native Americans.
She said, we didn't call it a temazcal, it was our sweat house. And it's fascinating because those are knowledge and wisdoms that we've forgotten, and how profound and how healing they are. So I think for us, it's just to educate people a lot more on how powerful our plants are, how powerful this element is of our earth, that she gives us everything that we need. And sometimes we're so quick to go to a doctor. We're so quick. I love doctors, I honor them, but sometimes we can do our own healing. So it's about empowering people to see what it is around you that's going to help you and make you better.
The Collaborative for Hispano-Latino Health Equity, better known as Chile, was created in 2015 and has Hispanic teachers as members. Along with other on-campus departments, they work to identify, address, and advocate for improved social determinants of health for undeserved and underrepresented populations in New Mexico.
One of the things that we do at the University of New Mexico is we're a Hispanic serving institution, and so we're trying to serve our population, more than half of which are racial and ethnic minorities, predominantly Hispanics.
According to statistics from New Mexico Voices for Children, in 2015, 33% of young people in the state suffered from poverty and 5% did not have health insurance.
When you live in a society that has essentially built its norms around exclusion of many groups, predominantly underrepresented minority groups, then you end up with something like what we have in New Mexico, health disparities, predominantly focused on underrepresented minorities. When you look at health indicators for the country, we're like at the bottom or at the top of the worst health indicator.
Chile is known for its various courses for the community. These courses help to conserve some of the medical traditions from Hispano-Latinos.
Chile is part of a health fair that we conduct every summer for the summer class. It's a one-day health fair where the community is invited, the university community and the Albuquerque community, and actually people come from even Texas and Colorado to this health fair. It's a course that reminds us of the contributions of Latinos to medicine, traditional medicine, because it was different at the turn of the century, and how it's changing and how we're learning from some of our colleagues in other countries on how to appreciate and understand traditional medicine.
Heritage that we try to recreate and pass to the next generations. These are the values that our abuelos and our ancestors have given us. The value of respect, the value of the family, and that's part of our responsibilities as faculty here at UNM, is how we can create a learning environment that values the history and our values, our traditions, and value who we are as a people.
The other thing is we have an amazing group that I'm very proud of. Dr. Cacari-Stone and many others here in the room are part of the Chile. the Collaborative for Hispano-Latino Health Equity, where we're looking at these are first generation graduates. We're talking about MDs, PhDs, PAs, people that already went through all those hoops. We are here to support the younger generation because we've been through it. We know what it feels like. We know what the challenges are, but you know what? You are not alone. We are here to help you. The other thing is there's a lot of young people with strive and with ganas. They want to succeed. We need to look at equity. What are we doing in terms of equity to really bring equitable opportunities? It's easier for a kid in high school to get a joint 3 blocks from the school than to get a scholarship. How can we change that so that we can make it more equitable and have more opportunities for our young people? The time is now. Join us, become part of the solution, porque el futuro está aquí. The future is here and it's you. Gracias.